Hello everyone, welcome to my channel. Today's topic is from medical surgical nursing. It is COPD, that is chronic obstructive pulmonary disease. Let's get started. COPD is an irreversible state of disease in which there is obstruction of airway, which is chiefly characterized by shortness of breath and phlegm. That means when a person reaches to a state where there is COPD, there is no reversing back to a healthy state. Yes, we can manage signs and symptoms, but there is no completely reversing back to healthier stage. The disease that can lead to COPD are emphysema and chronic bronchitis. This is a diagram showing a comparison between healthy lungs and lungs suffering from COPD. In the lungs suffering from COPD, bronchi and bronchioles are narrowed and blocked with mucus. This mucus is abnormal or infectious production. And if it is because of emphysema, there is a destruction of alveoli, as emphysema and bronchitis can be major risk factor for COPD. Etiology can be age greater than 65 years, air pollutants, exposure to air pollutants. Age greater than 65 years are prone to suffer from COPD. Occupational exposure due to a deficiency of enzyme called as alpha-1 antitrypsin. People who suffer from numerous respiratory infection during childhood, so their body might be weak and prone to a respiratory infection in the coming days in future if they are suffering from numerous respiratory infection during childhood. Risk factor can be smoking, both active and passive, emphysema, and chronic bronchitis. There is a pathophysiology. First of all, due to multiple exposure to risk factor, or if there is a habit of smoking, such people are at risk of developing COPD. Because of that, there is an inflammation of airways. Because of inflammation, there is activation of WBC components, that is neutrophils and macrophages, which results in inactivation of antiproteases, resulting in finally chronic inflammation of the airway. Also, because of deficiency of alpha antitrypsin, there might be increased elastase activity. So the muscle activity increases. Due to the excess muscle activity, excess muscle load, there might be tissue destruction. This both pathophysiology can go along or can occur individually. Clinical features are cough with mucus that persists to a long period of time, difficulty in taking deep breath because deep breath takes the whole muscle of chest to work for it. The whole muscle of chest is not able to work, so the patient is unable to take deep breath. Shortness of breath during stress because of emotion, because of physical, any kind of stress exercise, there is shortness of breath. There is wheezing sound while breathing. Unable to walk normally, patient is unable to walk normally. There is also fatigue in the body. Some of the associated features that come along with the main signs and symptoms are foul smelling breath, edema at extremities, weight loss, frequent morning headache, fever, restlessness, confusion, and slurring of speech. Foul smelling breath because airway contains infectious particle which might mix up and come out through the breath. Edema because there are electrolyte disbalances. Weight loss because body's fluid is lost due to infection. Frequent morning headache is CNS related symptoms. The CNS is not able to convey and transmit correct messages to the muscles, which resulting in headache. Fever, restlessness, confusion, and slurring of speech might also occur. Diagnostic test that we can perform for COPD is, first of all, history. We need to include many things from history, as age seems to be important, occupation, exposure of occupation should seem to be important, medical history, any disease in the past and medicine used for that disease. Also, personal history is important, habit of smoking, exposure at home, agricultural exposure, that is important. In physical examination, we can perform auscultation of breathing sound. We can find either wheezing sound or crackle sound. Also, we can do stress breathing test, keeping the patient under stress and letting patient breathe. After that, noting the pattern of breathing, that is stress breathing test. Also, we can do diagnostic spirometry, pulse oximetry, ABG analysis, ECG, and chest X-ray. All of these have been explained in my previous video. There are stages of COPD. Stage 1 is mild stage, where symptoms like difficulty in climbing stairs, cough production with mucus occurs. These are minor or starting signs and symptoms. After that, symptoms gets worsened. Moderate stage, shortness of breath during daily activities, phlegm, bronchitis, or pneumonia can occur. So, patient is a sufferer of some disease when it comes to stage 2. In stage 3, this is the severe stage. Pneumonia or bronchitis symptoms stay in the body now for longer than 6 months. On auscultation, wheezing and crackle sound can be heard. Not both are heard, either one can be heard. Also, chronic dyspnea. Some of the symptom remains for longer than 6 months. Dyspnea is one of them. So, chronic dyspnea and difficulty in performing daily activities because body is facing fatigue. In stage 4, this is a very severe stage in which patient needs oxygen for survival all the time. There is also difficulty in changing position because there is no enough oxygen for each muscle of the body. Also, there is slurring of speech in very severe stage. Medical management can be, first of all, bronchodilators to relieve the airway. Steroids, hormonal medicine can be given steroids for reduction of inflammation. Antibiotics to treat infection, anticholinergics to relax the muscles, and antiviral if the COPD is a result of viral infection. General management includes oxygen therapy, 2 to 4 liters per minute. Oxygen therapy can be started with this dose. Vaccination against respiratory infection, expectorants for cough release, respiratory exercise can be done. In this respiratory exercise, deep breathing and coughing exercise can be included. Also, chest physiotherapy can be included and normal respiration exercise can also be included. Preventive management can be avoid exposure to allergens, avoid smoking if it is active or passive both, and maintain an ideal weight. Surgical management, we can perform bullectomy, that is removing dilated air spaces, removing the air space which are no longer working. Lung volume reduction surgery, this is done to remove the infected and non-working parts so that body can still carry on performing respiration with the working part. Also, lungs transplantation can be done. A lobe of lung can be transplanted so that patient's airway exchange can be performed properly. Thank you so much. Next topic will be discussed in next video.